everyone, this is Rosie from Garcia Facial Plastic Surgery with Ultherapy today. So today we're treating Kim, and Kim has a customized treatment plan. So for her, we're going to treat muscle. She is currently working with some melasma treatments, treating her skin. So in order to combine the treatments, what we're going to do is we're going to treat muscle with Ultherapy. So instead of doing both orange and green transducer, we're only going to do the green, which goes down to about 3.0 millimeters. We're going to treat the muscle, but we're going to be a little more aggressive with it, so we'll probably run it twice on each section. And then I believe she's following up with Morpheus for her skin treatments. So we've already separated the sections, also making sure we're protecting the structures like your thyroid shield and your facial nerve branches. Same thing up here. We're protecting our nerve branches coming from our orbital notch, so we mark them and stay away from that area. We're going to work on neck, jawline, her lower cheeks, brows, crows, and also her lower eyelids. Alright, so today we're going to have a little bit of assistance with our Pronox, which is also known as our laughing gas. The great thing about laughing gas, it's self-administered, so whenever Kim needs to feel a little more relaxed, she can take a few puffs, and that will kind of relax her out a little bit. But 10 minutes after she stops using the laughing gas, the effects reverse, and she should be able to drive right after. Okay, so using our ultrasound gel, we will start with her cheeks today. So a question that we get very often is, who is a candidate for Ultherapy? And honestly, all patients can get a benefit from Ultherapy. We just have to acknowledge what are realistic expectations. So if you are a patient who has an excess skin problem in this area, something surgical might be the best option for you, but Ultherapy can give you some tightness, and it can also give you a collagen blast that will definitely make your skin look tighter and healthier. Then you have other younger patients who might not have a laxity issue yet, but are looking to have some kind of maintenance or prevention treatment. So we can do Ultherapy, just maybe not as aggressive as we would if you had a lot of laxity. Again, we can always give what we call a boost, which is just your superficial treatment. The orange millimeter, also known as the 1.5 millimeter transducer, that will just treat your skin, and that can kind of give you a more, not instant, but a more active lift, kind of glow to your face as well. You can see results a lot faster with a orange transducer treatment. We call that the booster, Ultherapy booster. So Ultherapy does not replace a surgical procedure. It is a good procedure for patients who are not ready for surgery. So whether it be a financial or just mentally not ready for surgery, Ultherapy can give you some lift and some tightening if you're just not ready for a surgical procedure. These results tend to last about 2 years. Some patients like to come back every year just to have a touch-up to maintain their lift. So Ultherapy is actually very safe. It is the only FDA-approved device for visualizing and lifting muscle. It's the same technology that has been used for years to visualize babies while they're in our belly. It's like an ultrasound, sonogram. That's what Ultherapy stands for, ultrasound therapy. And so we take extra steps to make sure that our patients are safe. For example, like what we mentioned before, we mark our main branches, our main structures, to keep away from them. And as long as we're visualizing correctly on the monitor where our muscle layers are, so if you kind of take a look right here, when you visualize your layers and you treat the correct layer, you're guaranteeing that you are performing a very safe procedure. Right. So you see skin, and you also get to see your muscle layers. So there's no downtime with Ultherapy. Ultherapy being a non-surgical procedure, you can have it done and go back to work the next day. Some patients will experience redness, and at the moment, once you're done, you'll see some kind of like tread marks. Not everybody experiences it, but a lot of patients do. They look like little tread marks, but by the time that you get home, it's usually gone at that point. A little bit of redness that same day, but by the next day, you're good to go. Therapy lasts 2 years. Many patients like to do a touch-up at about a year or a year and a half mark just to keep up the results.